To start, to kick off, ladies and gentlemen, I would like to hand over the mic to someone who is in the driver's seat of this ambitious project, and that means clap your hands, please clap your hands for the Prime Minister of Belgium, Alexander De Croo.
Good morning, everyone. Let me first of all welcome all of you here. Of course, from my side as well, Mrs. President of the Commission, dear Ursula, it's a tremendous pride for us to welcome you here. It's a great honor. We are here to mark a first step in a journey that has started quite some time ago. Actually, it's almost a year ago that in the midst of the COVID crisis, we saw in Belgium what we have. And we saw this incredible position that we have. In the meantime, the rest of the world has discovered the position that we have. Everyone knows the important role that we have played in fighting this COVID pandemic. But the real question we had was, we know what we have now. What is necessary to make sure that 10 years, 20 years down the road, we still will be at the core of so many things happening in healthcare and in bioscience, and this is the journey that we started together. We used the help of an outside partner of BCG, who was very instrumental in helping us and in really connecting this very diverse cluster that we have in Belgium. And this is one of the characteristics, is that we are not just good in one element of the chain. We are actually good in so many different elements of the chain. The whole idea is we are great today, but what is necessary to make sure that we can maintain this position? Now, of course, we do this in on a European scale. Ursula, I think you have demonstrated over the last months that as Europe, we succeed when we work together. We succeed when we connect the dots. And we know that the exercise that is being done here is, of course, a Belgian exercise, but it is made within a broader perspective. And so we're extremely happy to have you here. I think, Ursula, over the last 2 years, I should say, you've really shown of what we are capable of in Europe, what we are capable of when we bring everyone together, and what we are capable of when we have the right leadership. And we're extremely happy that you have led us through this crisis together with the European Commission. And we're, of course, extremely happy that you are here to support the strategic exercise that we have started. Ladies and gentlemen, Ursula von der Leyen.
Thank you so much, Prime Minister, dear Alexander. Ministers, state secretaries, distinguished guests, and I'm very glad to see the grand seigneur of the vaccines, Professor Peter Piot, here in the audience too. I'm delighted to join you for this indeed official launch of the Belgium Biopharma platform today, and I'm delighted to join you especially because it is in person that we meet here today. And I'm explicitly mentioning this because a physical meeting today would not have been possible without the success story of the European vaccination campaign. But this European vaccination campaign, this success story, would not have been possible without Belgium. It was in Belgium where the new mRNA, the life-saving mRNA vaccines, have been produced for the very first time at large scale. It was Belgium which played a key role in the clinical trials. And it is Belgium from which Europe sends a big part of the vaccine it's exporting to countries all over the world. I had the pleasure to visit the Pfizer site in Poers. It is really a true vaccine powerhouse, like so many of the world-leading pharma innovation centers you have here in this country. So today I want first and foremost to thank you for the steadfast support that you have shown, you personally, Alexander, dear Prime Minister, but also Belgium as a whole, This was outstanding, and from the bottom of my heart, many, many thanks for that. I also warmly welcome the same, as you've said, European direction of the biopharma strategy that is presented today. Belgium provides, and I can tell because I have I oversee the 27 member states, you provide an incredibly conducive, enabling environment for the biopharma and biotech industries. You have world-class universities, you have well-known hospitals, you have an experienced and talented workforce you attract from all over the world, and you have a very strong focus on innovation. And it is good to see that you are building on this strength with your new biopharma strategy, a strategy that puts European cooperation at its core. Ladies and gentlemen, indeed this year has shown why the pharma and biotech sector is such a strategic asset for our union. The whole world has been caught off guard by COVID-19. But today, if you look at the results now after 10 months of vaccination campaign, we have not only more than 75% of adults in the European Union fully vaccinated, but, and this is where we should really take pride in, we have also exported more than 1 billion of vaccine doses to over 150 countries. We have made good on our promise that at least every second dose produced here in the European Union will be exported, shipped abroad. And indeed, it is more than every second dose that has been produced here in the European Union that has been shipped abroad. So while others have isolated themselves, Europe offered help to the world. It was a choice we made together. It is the result of our joint effort, and I really think we can be proud of that. But we have not yet defeated COVID-19 unless we can control the virus in India, in Africa, in Latin America, and across the globe. And this is why Team Europe, that is the European Commission and the European member states, are now investing more than 1 billion euro in establishing mRNA manufacturing capacities in Africa. I know that Belgium, with its expertise and with its know-how, can contribute a great deal to this strategic project. And we will do more. I've started, together with the US President Joe Biden, a vaccine partnership, EU-US vaccine partnership, to beat the global pandemic. And we've set ourselves the goal to have 70% of the global population vaccinated by next year. The European Union will donate more than 500 million doses within the next month, and also the United States will do their share, but of course other countries have to step up and to contribute too. And therefore, I'm working very closely now with the G20 presidency, that is Italy, Mario Draghi of Italy, and the American president, that this weekend at the G20 summit, we rally the leaders around the goal to have 70% of the world's population vaccinated by next year, and thus to step up the donations and to step up the manufacturing of life-saving vaccines for the whole world. This is the focus at the moment being. But of course, at the same time, we have to prepare ourselves for future health threats. A great European, Jacques Delors, once said, in the face of a crisis, you need both, a fireman as well as an architect. So the firefighter, I'd say, are the vaccines. But let's talk for a moment about the two pillars of the future architecture, the lessons we've drawn out of this crisis. First of all, we have created a new Health Emergency Preparedness and Response Authority, long name, in short, HERA. HERA's task is to better prepare for health emergencies, to detect them more earlier and promptly, and to respond collectively. All three things we didn't have when COVID started. We were not prepared, we had no clue how to detect it early enough, and we had no joint cooperation in place. We all had to learn that. So the scope of HERA will reach from collective procurement, for example, of protective equipment, medicines and vaccines, to coordinating, for example, the rules for testing and quarantine and all you can think of what is necessary if you're faced with such a cross-border health threat. We will also strengthen the European pharmaceutical sector and the health ecosystem, in which Belgium is such a prominent actor. And this brings me to the second point. Here we have the innovation and the scientific capacity here in Belgium and in the European Union. We have the private sector knowledge. If I look at you here assembled here in this room, I mean, there's a huge amount of knowledge and scientific and innovation capacity. And we have competent national authorities. So what we need now is to bring all these elements together and to underpin them with massive investment funding. Let me give you some examples. Take the European Innovation Council that, for example, supports now the highly innovative SMEs in the area of infectious diseases. Or just recently, this European Innovation Council announced financial support for Belgian biotech company that develops tools for precision microbiome profiling. And of course, then there is our huge recovery fund. We call it Next Generation EU, 800 billion euros in today's prices. And here the member states are using these funds, indeed, to make them available to the research community, to build resilience, healthcare capacities, and to invest in innovation. Belgium, for example, Prime Minister was very happy to see is investing in a biotech school, or you're investing into research and development supporting the production of medical radioisotopes. So all this, taking the research capacities and joining them with the necessary funding, bringing it all together, all this helps us to prepare better for future health threats. And I think there is no better return on investment than that. Distinguished guests, this is our European way to do things, while of course repairing the damage of the crisis. We are investing in a better future. And it is great to see that with this biopharma platform you are creating today, you are also going in absolutely the same direction. So I count on Belgium to continue to drive European cooperation in the future. I count on Belgium by enriching EU programs, for example, like Horizon Europe. I count on you in engaging in our new HERA authority. And of course, I count on you by mobilizing your brilliant researchers and entrepreneurs. I especially welcome the ideas you develop in your strategy on how to address potential vulnerabilities in our supply chains. This is also a big topic. I will not go in depth, but this will be also a big topic at G20 this weekend in Rome, the summit. The supply chains that have been interrupted by the lockdowns and COVID pandemic all over the world, and we see now how difficult it is to bring them back in place. But what we also learn is our huge dependency on supply chains. So we have to look how to diversify our supply chains, how to strengthen them. I'm not talking the word to only onshoring them. That's not the solution. But to be more diverse in the supply chains, to have a strategic reserve that is here on the continent, but also to be able to strengthen our supply chains, that will be one of the big lessons we have to learn from this pandemic. So I want you to know, as I've looked at the concept of this platform, that whatever you plan also regarding the supply chains from strategic stockpiles to the ramping up of the local production, rest assured that you have the full support of the European Commission. Ladies and gentlemen, extending our positions as leading biopharma hubs will bring benefits to all. Patients get a higher quality of care. They get an easier access to innovative therapies. The economy gets a boost, as we will attract not only the funding I was just describing, but of course also international investment. And our society at large benefits from this tightly woven network you have of research institutes and enterprises. We are in this together. A strong Belgium makes our union stronger, and a strong union makes Belgium stronger. So let's get to work. Thank you very much for the attention.